Previously on Birth Stories.
I'm thinking it'll go quicker too because it's the third, and because I've been doing this for 4 years now, I'm thinking my body's like ready to just like pop this one out.
I don't have the grip in my hands to close this like that. I don't have any strength in my fingers. What I would usually do if it were me is just push against my body. Well, to do that against the baby is going to be very painful.
The plan was to give birth to her third baby at home, with a catered party surrounded by family and friends. But earlier this morning, a week away from her due date, Donna's unborn child stopped moving. Donna's been rushed to the hospital to have her labor induced.
It's the weirdest thing. Like, this whole thing started today because I woke up on the right side. You know that today? Did you know that that's why this whole thing started today? Because, you know, I've been very careful to stay on my left side because I know it's the best, really, position, right, to sleep. Yeah. And I remember rolling over to get water last night that way and thought, I can't move back. But that's what started this whole thing of me even being concerned. So, you know, when I went over to the left side and then felt zero movement.
Yeah,
like,
but that wouldn't have been the cause.
That wouldn't have been the cause, no. But that's what triggered me.
Yeah, that's what made you worried?
Yeah.
Yeah. But you're having really nice contractions now, Donna.
Yeah, I'm just slightly
every 2 minutes.
Now. I can handle
that. 45, 50 seconds.
Yeah. Oh, yeah.
Angie was born with arthrogryposis. It has caused stiff and painful joints, a malformed left arm, club feet, and debilitating pain that requires daily morphine.
Here you go. Got your food right here.
But the most immediate challenge in Angie and husband Steve's lives, a new baby boy named Cameron.
And then I'd be happy to feed you. I promise you. I promise you it won't take a couple minutes, okay? In my back. This is non-skid. So when we put the pillow on, the pillow doesn't move, and El Bambino stays put when I feed him. When people are around, it's, of course, so much easier for them to help me get set up. But if I'm by myself, I can do this on my own. I can put the bassinet right beside me and have everything set up here. Then it's in his bassinet. Then what I do, his food. Then what I do is I'll sit him on my knee and kind of scooch myself up to the couch and set it up. Then I'll kind of sit him half on my chest or up on my shoulder and then pull this over. Okay, mister. Okay, mister. Here we go. As soon as I got comfortable with him, I think that's when I started feeling really mom-like. There you go. I just would like to see the next couple of months us settling down. Stephen will be going back to work, and I'll be alone with Cameron. So, you know, seeing what I can do and what Cameron can do. And just basically being happy with life. What I try and do to burp him, it looks like I'm strangling him, but I'm not. I'm just supporting his head, and then I'll just kind of put my hand underneath his chin and push him up like that, and then I'll hold him underneath the head, and I'll just rock him gently. And oftentimes, he'll burp. Many times he won't. He's quite stingy with his burps.
Oh, funny, the heart rate keeps dropping.
No, I was saying because we're having a contraction with her. It's just the baby's, you know, it's head compression. Mm-hmm. The baby's head's getting squeezed as the you know, the head comes down. Mm-hmm. And sometimes that can happen fairly quickly. So the variability in the heart rate has been much better since she got the epidural.
Oh.
An irregular fetal heartbeat increases Donna's anxiety. Any thoughts of a birthing party are vanishing.
Yeah, that's a contraction right there. Damn, I wish I wasn't feeling it.
sometimes when you increase the level of the oxytocin to, increases the
Of course.
the strength of the contraction, which is what I wanted to do, but
But we don't want the baby to be very
No,
upset.
but we don't
Although
want-
the baby can't be in there for hours and hours either. Gary's gonna get a vasectomy after this. I'm not gonna go through this again.
No, okay.
Hi, Doll.
No, I don't think so.
Hi, Dolly.
Hi, Angie.
Where's my baby? So high. This is a far cry from our bed at home.
I would think of what we saved on catering.
Yes.
Shaking. Did you buy it?
We'll have the party after.
Turn it off. It says off.
Get it.
Jim, back.
I can just pull all of this stuff out.
Tyza is 8 months pregnant with her second child. Her professional life demands confidence, but her first experience of motherhood was a confidence killer.
I'm an art director, and I actually worked in an agency, pretty large agencies, until I had Adrian, who's my son of 3.5 years. And I remember talking to a lot of my colleagues saying how I couldn't wait for my maternity leave to, catch my breath. And basically, I thought I was going to be on vacation, doing catching up on all the things that I wanted to catch up on, and reading my magazines and the paper, and et cetera, et cetera.
You look at that?
Listening to other people's stories, it always seems so much easier, and everybody seems to be organized and have time for everything, and I just didn't, and I didn't understand what I was doing wrong.
Right here.
I just wish somebody had tipped me off, because I was the first, really, within an extended group of friends that had a child. I didn't have a measuring stick, so I had no idea.
But now they're telling me the baby's in a posterior position. Like it's not even in a great position. At least it's not breech, but it's face up, I think, instead of down.
The posterior position can make it more difficult to keep the baby's air passages clear during birth. Another complication that has Donna's tension building.
I got it. I got the name. Reese. Reese Wilson.
You know what? Now the baby's posterior. Like I just want it to be born healthy. Okay, I don't want to hear any more names.
Okay, then why don't we clear out then?
Yeah.
All right, that's what we need to do.
We've been
Sorry, Angie. I know you mean more. I'm sorry, but
Well, I'm talking.
We just walked in.
yeah. No.
I'm saying, do you want to do that?
Yeah, I think so. Okay.
I know you're tired now too, aren't you?
Haven't had one of these for a while. We're going to be back in the realm of dirty diapers, which is something I'd managed to put out of my mind.
I know.
You better get off, Adrian, because we're going to move this into the back room.
Tyza and Brendan's son was born a large and healthy baby, but he quickly became inconsolable. He was desperately hungry, and Tyza sought help from a breastfeeding clinic.
He wasn't getting enough. He was born at 9'3", and within 3 weeks, he went down to 7 pounds, 12 ounces. I was desperate. I was watching my child suffer. I didn't know why. And they would tell me that every woman lactates and every woman can breastfeed successfully, and every woman can. In fact, their success rate was so great that they could make adoptive mothers lactate.
It was the breast club, the bottle club. Don't do it. You need to have that connection. You need to have that bond.
Your judgment is off, too, because I'm sure I was warned. I know with my mother was adamant, the child is suffering. Can you give him the bottle? It was that easy for her. Mm-hmm. I actually remember one woman told me that it's possible that Adrian has a neurological disorder. So, I mean, it was
It's not what you need to hear at 2.5 weeks or 3 weeks,
I was at the end of my rope, and my trust for these people was, completely through the floor.
Sure.
I asked them to hook me up into a breast pump. The breast pump was going for 20 to 25 minutes, not a drop. I felt like their need to prove that any woman can lactate was more important than me or Adrian.
Hey, buddy. We're gonna go see doctor today. You ready? Okay.
Baby Cameron was born normal and healthy in every way but one. When his mother took morphine for her pain, some of it passed into little Cameron's body. After several days of severe withdrawal symptoms, doctors put Cameron on his own morphine dose so that he could be weaned off the drug slowly over several months.
Hey, buddy. The first week was absolute chaos, mayhem, and crazy. The second week was just as crazy, but we were starting to get the hang of it. This past 2 weeks have been really good. We've been getting the hang of Cameron, and I think he's been getting the hang of us, and his medication is really down far, and we imagine it's only going to be about another month before he's totally off the meds. And we're getting into a really good routine that all of us are getting comfortable with, especially Cameron. He's just a really good little guy. When he sleeps very well, and when he gets worked up, he gets really worked up for several hours. When he's with a lot of people, when there's a lot of company over, he'll be a little bit of a pill when he settles down again. When everyone's gone, he's usually a bit of a nut for a while afterwards, and then he'll settle down again. So we still are seeing that a lot of stimulation sets him off. So we got to keep his stimulation down. There you go. You're all set to go to see Doctor. Hey, you're set to see Dr. Linders. There you go.
At where I'm at now is I don't feel guilty for giving him the bottle, but I do feel guilty for making his life miserable for the first 3 weeks of his life. Like, yeah, as much as they say breast is best, I think that getting nutrition is better than anything. Right. So I would guess with my last experience that I'm obviously not going to be producing milk in any great way, but I would say whatever the child needs. If I can breastfeed and it's successful, great, but I am bringing formula to the hospital, let's put it that way. So.
Donna Wilson, fully dilated. Okay. Thank you. Bye.
There's a new setback. Donna's midwives have discovered meconium in the amniotic fluid, which can be harmful if it enters the baby's lungs. A neonatologist is alerted and on standby. Meanwhile, Donna's epidural doesn't seem to be working.
I know.
And you're just going to go through that and it'll pass, okay, Donna? Mm-hmm. Because that's going to be different this time.
I want to be frozen.
Donna, you know what?
It's pushing my bowels out.
Okay, that's the feeling of having a baby, okay?
Okay. Please.
Not yet, but
Why? I'd be better. I was so much better with rock because I was frozen. Help me, please.
It's up to you.
Please.
She's
Fully, but she would like to be topped
I
up.
need to be topped up, please.
So Donna, remember when the baby's head is born? We talked about that
The
type.
panting.
The pantings, and then I'm just going to suction when the baby's head is fully born. The mouth and the nose, okay?
Should I be pushing?
Should you feel the contraction? Yeah.
Okay.
Yeah.
Good.
Take a big breath in and push down.
And put your chin on your chest, maybe that'll help.
Now, so let's see here. So you're managing pretty well.
Yeah, so far so good. You want the
Very well.
soother for him?
650, so perfect weight gain.
Excellent.
Can't do much better than that.
Excellent. I'm happy about that. We might. Sorry, I'll wait for you to finish.
Just have a quick listen to his chest. Nice and clear.
Yes. He's. This morning he sounded a bit congested, but I think, his nose gets really stuffy.
Doing a good old grin there. Certainly not jittery though, it's very relaxed actually.
Yeah.
And his mouth looks good, he's no yeast, and his
We put a little bit of Vaseline on his head, or not Vaseline, oil on his head this morning.
Yeah.
Because he's starting to get a little bit of dry skin up there.
Yeah.
So.
I'd rather you use just a little bit of Vaseline, actually.
Vaseline?
The oil
Oh,
sometimes
okay.
makes them reactive. He's beautiful skin, so.
Okay.
And again. Big breath in and do it again. That's lovely. Very nice. Lovely, beautiful.
Donna, do you want to feel your baby's head?
No, just breathe the baby out. Give me a little push down. Little push.
What's it here?
Little push. That's it. Lovely.
Face is born on this corridor.
Midwives suction the baby's air passages even before it is fully born.
Okay, do we have more to come out, or is it?
Yep.
No, the baby's head's out.
No more.
There will be one more surprise, a knot in the baby's umbilical cord. It's a potentially life-threatening condition for an unborn child, capable of cutting off the supply of oxygen.
Hey, little one.
Here we go.
I'm just gonna cut the baby's cord. Okay?
Dr. Kraskova here.
No, yeah. We've suctioned the baby. She'll suction more on the baby.
I'm just gonna cut the cord quickly, okay? Sorry. That's gonna be okay. That's okay. Glad to hear that.
But is that okay?
Baby's fine.
Baby's got a nice
What is the baby? What is it? We don't know what it is.
It should be suctions first.
We suction the
Please
baby
stay
before
back,
it's
Do you want to tell us what the
Okay.
baby is? A girl baby? Oh, girl.
It's a girl. That's okay. I just really, Teresa, you're covered in me. You bet you cannot, yeah.
Donna only has a brief glimpse of her newborn before a neonatologist whisks her away to the neonatal intensive care unit.
Okay, we're finished. You're absolutely fine.
Okay.
And
Well,
his
that's great.
I was just checking his moral reflex there.
Okay.
And that's a nice one there, his arms go
Okay.
out like that.
Okay.
No, he looks great.
All right.
So just keep doing
Excellent.
what you're doing.
Okay.
Now he's still on a tiny bit of the morphine.
Yes, we have him down to 0.03, and we gave that to him starting Monday, and he had a couple of unsettled days, but now he's starting to settle again a little bit. So what we'll probably do is lower it to 0.2 and then to 0.1, because it just, the slower he goes, the better he'll react.
Yeah, well, you can do it as slowly as you want,
Okay.
you know. So why don't I give you a script for 0.02,
Okay.
and with that script then you can just half that down again.
Okay. He loves the stuff. It must be really sweet. Okay.
Take care now.
Thank you.
He looks great.
Great.
Bye-bye.
Thank you very much.
Bye.
Hey, Pumpkin. Okay, let's get you dressed, little man.
I can't believe that knot in the cord. Like, when would
You
that
can
have
see
occurred?
I'll just change this and get you all cleaned up in the washcloth.
For all Donna's fears, the reality was more frightening than anyone had guessed. Donna's baby had been in real, undetected danger for months.
Yeah, yeah. See, I'm still not settled till I know she's gotten through whatever the...
And we'll get you a nice warm blanket in a moment, okay?
Thank you. Oh, it's okay. These are inside shivers.
These are the good ones, right?
Probably, she looks like between 6 and 7.
Yeah,
that's what I guess.
She's all
nice
in
and
one
firm.
piece, which is the main
As long
thing.
as she keeps breathing. I'm worried, like, is there ever an after effect, like, from the, like, if the meconium's gonna cause problems, is there still a chance it's gonna happen?
Do so within 12 hours.
Oh, so I still have to worry for 12 hours.
No, don't worry. Just have faith.
Don't worry.
It's out of your hands now.
Just have faith.
Well, this is the thing. Like,
All the confidence that you ever have before you have a baby. When you have a baby, you're back to ground zero. Like, you really need that confidence. You do finally realize that your child is bonding with you, and not because you breastfed, and not because of, but just with the time that you spend with that child. That's where all of my confidence came from.
We used to laugh at, the sus or the pacifier that we used to give him. I mean, you know, when he was 6 days old, whatever, you'd drop it and then you'd boil it and you'd sterilize it. By the time he's 6 weeks, you'd just pick it up, you know. By the time he's, you know, 6 months, you're wiping it on your jeans and giving it, and it's that kind of, I think, you know, realization that you know, they're fairly durable little beasts, I think, in, you know, in the long and short of it. So
I'd have these nightmares at 18. He'd come back to me and say, "You did it all wrong." From the bottle feeding to the...
Yeah, I am. Actually, I'm feeling better this time than the last two, so that's a good thing. Even though it was the most stressful emotionally, but we're okay.
It's the morning after, and visitors hear of Donna's rough ride the day before. Her baby appears to be out of the woods and is finally safe in Donna's
the whole thing,
arms.
and waking up yesterday morning and not feeling any movement at all. For over a few hours. It was a very eerie feeling because this baby had been moving so much for the last 2 weeks. I knew her head was down, she was ready to go. I'd been getting contractions all week, but nothing, you know, serious. And then
nothing.
And then nothing. She latched on like that. Oh, it was great. Well, that poor thing. She's been starving. But she seems all right. Like after what she's been through, I think we're gonna be okay. Thank God.
Next time on Birth Stories.
This sounds crazy, but the only thing that makes me nervous is getting the IV. It always, because I don't have very good veins.
Yesterday afternoon I had another bleed, so I went back over there, and now they're just being a little more cautious, so they're just making me stay in bed, and I've got the IV and complete bed rest now, no bathroom or anything, which sucks.
It's been fairly amazing, and this is pretty much a miracle baby, aren't you? Huh? Huh? You don't behave like one, but you are. We're very lucky to have you, aren't we? Hmm? Oh, very lucky to have you.